Hey guys, welcome back to my channel. My name is Dr. Tossin and today I'm going to be talking about bloating. So bloating is actually very common, and around 70 to 80% of women complain of moderate to severe bloating on a day-to-day basis. It's often described as this feeling of fullness, tightness or distension of the stomach, which can happen a few seconds or minutes after eating. It often makes people feel very uncomfortable, and people can often describe their belly as having a baby's belly or being a few months pregnant. Your clothing may not necessarily fit the way you want it to, and this can make people feel quite self-conscious. So in this video, I'm going to be talking about what causes bloating and more importantly, what you can do to reduce it. So there are three main causes of bloating. The first thing is having too much gas in the gut. This can be caused by swallowing too much air or can be caused by certain conditions such as acid reflux. Secondly, it can be caused by digestive issues. So issues which affects the movement of food through the gut, or conditions which causes inflammation or malabsorption of food through the gut, such as celiac disease, irritable bowel syndrome, inflammatory bowel disease can cause bloating. The other things that can cause bloating are hormonal changes. So you may have noticed before or during your period you're more bloated than normal, and that's due to the hormonal changes which happens during menstruation. So what can you do to reduce your bloating? The first thing is making sure that you're not swallowing too much air. I know that sounds a little bit weird and a bit unusual, but we all swallow small amounts of air when we're talking or when we're eating. However, if you're eating your food too fast, drinking a lot of carbonated drinks or chewing gum all day, that can cause you to swallow more air than normal, and that can result in bloating. The second thing, which I think is very important, is checking that you don't have a food intolerance. A lot of people have food intolerances and they're not aware of it. One of the most common type of food intolerance is lactose intolerant, where you're deficient in an enzyme which breaks down lactose in dairy and milk into smaller pieces. As a result of this, you're not able to break down lactose, and this remains in the gut. It ferments, produces gas, and that can cause bloating. There are other food intolerances such as wheat or gluten, and there may be certain foods that you may be intolerant to that other people might not be. So it's important that you keep a food diary for about a week, checking whether certain food groups are causing bloating in you, and then eliminating that from your diet to see whether that helps. The other thing is making sure that you're not constipated. So everyone's bowel habits is different. Some people open their bowels once a day, some people go every other day, some people go every few days, and that's fine. However, if you're noticing that you're not going as frequently as normal, or you're straining when you're passing stools, that may indicate that you're constipated. And if that's the case, it's important that you increase your water intake, consume more fruits and vegetables, and also increase your fiber intake. So that brings me on to my next point, which is making sure that you're having the right fiber for you. Although fibers are generally good for you, there are some fibers which can cause more bloating than normal. And this is grouped together and they're known as food map type of food. This includes things like wheat, cauliflower, onions, apples, legumes. There are a number of different food within this food group which can cause bloating. So it's important that you keep a note of all the different types of food you're eating, and also trying to eliminate those food groups from your diet if it is contributing to bloating in you. The other thing that has been shown to reduce bloating is exercise. Most people often go into a food coma after they've eaten, and the last thing that you want to do is go for a jog or go to the gym. However, it has been shown that going for a light walk or even standing a few minutes after eating can help increase the movement of food through the gut, and that can reduce bloating. You can also try things like ginger tea, peppermint tea, chamomile tea, as that's been shown to reduce bloating in some people. And I'm sure you've seen all over social media green powders being advertised. These are basically supplements which contains powdered fruits and vegetables that you mix with water and you drink. This is relatively new. Some people have claimed that it helps reduce their bloating, but there hasn't been much studies on this, and it's not very well known whether it does reduce bloating, but it's something that you can try out, but you have to be mindful that these powders are quite expensive. The other things are probiotics. So probiotics are basically live microorganisms such as bacteria and yeast which live naturally in our gut. You can also get them as supplements, or they are found in some yogurts, and they're known as the good and friendly bacteria because they help to promote gut health. There has been some studies which have shown that probiotics does help to reduce bloating. However, these studies are also very limited and it's not very clear whether it does or not. So it's something that you can try and see whether it helps with your bloating. So what do you do if you've tried all this stuff and it hasn't helped? So at this point, I will say it's important that you see your doctor. The reason why is if you've noticed that your bloating is going on for more than 3 weeks, or you've tried eliminating certain food from your diet, or you're getting other symptoms such as changes in your bowel habits, loss of appetite, weight loss, blood in your stools, this may indicate that there is a specific condition that's causing your bloating, and as a result of this, you need to see your doctor to be able to identify that. It may also be due to more serious causes such as ovarian cancer, which can present in a very non-specific way. So if you're having those symptoms, then it's important that you see your doctor to review you. I hope you guys have enjoyed the video. If you have, and you've managed to stay this long in the video, please make sure you like the video and you also subscribe to the channel. If there's any specific topics you want me to talk about, please leave it in the comment box down below, and I'll see you guys in my next video. Bye!